Your hostess?
No, no. It's because of their age. They don't have, they're not used, and so things don't show up. And so this is C1, here's C2, here's C3. What you're going to see is in the next radiograph, this is C3, C4. So this there's cervical spine 3, this is cervical spine vertebra 4. What's happening here is this one is dorsally subluxated, right? So C4 is up, C3 is here, and you're getting a pinch of the spinal cord right here. This is how wide the spinal canal should be. This is how small it is here. What we're going to show you is the next picture. This is normal. This is the abnormal one. This is the normal one where they should be at a plane, and you can see that, and we're not going to even measure it because it's got no purpose, but there's what they call sagittal ratios. So this should be opened up about twice as much as what it is. As you go down the vertebral column, your sagittal ratios actually get smaller. So you actually get smaller and smaller as you go. This one's so bad that I'll fast forward you to the true radiograph. This is the radiograph that shows you how significant that really is. This is where you appreciate this sagittal ratio, meaning how open the spinal cord is, should be much smaller, much larger than what it is back here, but you can see this one's crushed. There is no way you would go into a CT scan and not see spinal compression here or spinal cord compression here. So that's good for y'all. That's normal. This is what's abnormal. And this is what Dr. Rachel was worried about is, did this horse have a neck issue? And once she said it, once I looked at him, and once you feel of his neck, really right here, he's got like a depression in his neck where there's just less muscle there. There's there's atrophy there. And it's almost pathognomonic that these, even here, what's happening is there's supposed to be dorsal spinal, what they call nerve roots coming out of this location. They're probably getting pinched too with all of this exaggeration, that they're probably getting pinched. So he's getting some dorsal spinal nerve root compression too. But the only way to manage this at all, because for y'all and for Dr. Rachel to manipulate this, you have to get this thing to plane out like this, and there's no way to do that. What typically has happened is there's a spinal ligament that runs, an intervertebral ligament that runs right over the top of it. More often than not, that spinal ligament is completely gone, so you don't get the help from that spinal ligament. And once this stretches, it's like a bad rubber band. Everything gets too tight and you can't get that. But what happens with these, and what happened with him, is as a young horse, they compensate, they can deal with it. As you get them to work, as you move their head around, this gets worse and worse and worse, and you start to get this kind of widow's peak that you're seeing there, is that this starts to get this bad, and then it's pinching the spinal cord. You typically will see ataxia on the front end and the hind end. This one is probably much worse on the hind end just because of how compressed the spinal cord is. Yeah. So unfortunately, there's very few veterinarians that are treating this, but it's a $10,000, $12,000 surgery to go in there and fuse those. And we have one.
Yeah, what is the percentage of outcome for that?
Yeah, probably 60, 70% on those horses. The surgery, the basket surgery, actually does a really good job. We have one that just had it done, but he was a 9-year-old. We fixed this one, and then the next one started to dorsally subluxate too. So that's now a concern, right? That we probably didn't have kind of previous to that. Is, okay, is this one perfect and the rest, or is this one bad and the rest of them are perfect, or is this one bad and the next one's bad? It's just not showing yet, but this is almost pathognomonic for what you call a Wobblers. He's a 4-year-old horse with cervical spinal instability at C3, C4. I mean, this is like classic textbook, Wobblers. So,
thank you.
Unfortunately for Aaron, that's without surgery, it's unlikely that you will ever get this horse even better. Right. He will never be rideable, right? But I think some of the adjustment stuff that Rachel has done probably makes him look better on his front end, which makes the hind end look worse, right? Like she even said that. But I told her if we didn't find anything on x-rays, then the next step for everybody was going to be testing this horse for EPM. That rules everything else out. Like, we know the answer. the thing Aaron has to decide is, what do you do with this horse going forward? Because he could be, and I say this, he could be a pasture horse, but he'd have to be a pasture horse by himself, because if he goes to run around and play with anybody, it may look like somebody's beating him up. This may not have been anybody beating him up. It may have been that he fell on his own, or
I've had EPM horses, I know how it goes.
Yeah, and so this is just that. You don't know that the other horse was actually beating him up. He may have fell into the wall on his own, but that's probably likely the case that we know that now. Is that
and he's lost his self-awareness.
Yeah.
So it could be that
that's where I said, like y'all said, he won't stop. He wants to continue going forward. He's not self-aware of his front end either. He's very unaware of all 4 feet.
It makes him a little dangerous.
He is very dangerous. Yeah. And that's where this, if you don't fix this, he's not just dangerous to himself. He's dangerous to people. And unfortunately, I just don't see a reason, other than if Rachel thinks she can get this somewhat mitigated, and I just don't think it's going to be the case. Because now, as a 4-year-old, what has happened is all of this has changed, and now all of this muscle is structured that way. But you try to manipulate it, and you're more than likely for this to go further rather for this to go the opposite direction. It just, the way the muscles in the neck work, it just doesn't decompress very well. But I'll leave that up to the discussion between Aaron and Rachel and where they want to go with this. But I think what answers Rachel was looking for, it's staring you in the face.
Yes, it is. Okay, thank you.
Fortunately, unfortunately, the answers are the answers, right?
I will forward it to the hive mind.
Yeah.
Thank you.